Welcome to RT 340 Purple Packet Training for Clinical Instructors. Now, when you look at this document, it comes in a purple folder, which is not unique to this course. All students from Maloney College bring in the purple folder that contains a packet that they need to complete for the rotation. Now, critical care in this case is their goal, and that was RT 340 to-do list that you saw. This is part 2. Basically, the student will have their name, they'll write your name here and the hospital. Every single day the student visits the hospital, the RT will initial here, put in their full name and their signature to signify that this is a real case and that the student didn't go visit the mall. Yes, that's funny, but I've heard where people have not gone to clinicals and faked everything. So we're trying to keep everything legit so that they can earn their licensure. Next we have is if you have things that you want to discuss with the student, these are some good topics that they'll be learning this coming semester. You can talk about the case study and obviously keep them HIPAA compliant. And you will date it the day you discussed it and initial here so that you know that the student was aware. And then you have the ARDS and refractory hypoxemia. Modes, you can talk about different modes. SAT, SVT, neurocheck, weaning, mechanics, cuff leak in a sequence, that would be the best, really. They have never seen weaning right now, so that would be a great way to start them. Analyze 3 ABGs and EKGs. Quiz them if you want, really. You can quiz them, give them an EKG and say, you know, next time I see you, I'm going to quiz you on EKGs. They tend to struggle in it, but keep it basic. Basic EKGs, AFib, A-flutter, VFib, VTAC, normal sinus rhythm. PEAs are actually one of the bigger ones because they don't understand what that is. Go over that. And then finally, analyze x-rays. If there's nothing else to do, you can analyze. And you can initial these as you go. And I'll add a section here where the student also signs it that I understood that I've done this with my clinical instructor. Next we have here is what they're going to be accomplishing in this course when they're visiting the hospital. In the adult care ICU, they should complete this packet to up to 80% minimum to 90%. 100% the best, great, but they still have another course coming up next semester, so we have room. So 80% would be the best. Set up equipment for intubation, assist with intubation procedure, extubate the patient, perform blind nasal suction, tape endotracheal tube. I'll send you a copy of it. You can go through it by yourself, but I want to take your attention to the asterisks. Anytime you see an asterisk, these are the mandatory items they should experience because it's time that they start exploring the ICU and see what goes on. There's quite a few of them because sometimes students don't take advantage of events. One of the main ones I really want to discuss is weaning and SBTs and SATs. They need to understand that SAT is performed by an RN. Then we can get into SVT or after the patient is doing better, proving MIF is stable, RSBI, so forth. Whatever they accomplish, they should be getting an initial from that RT. Okay. Next we have here is PEEP and CPAP. Our students tend to struggle with CPAP, BiPAP concepts. It would be wonderful if you can spend some time on some of the cases, but most of all of this packet with the checkoffs is done with an RT. Okay. After they're done, you're just checking did they get signatures up to 80%. So you would say that that would mean up at least 3 boxes are filled per item. Okay, that's 75 technically, but if they do 4 in one of the categories, great. And at the end, you see the yellow highlight. It's for you. They would then you would talk about when you sign this only if you've done data arc evaluation. I need this packet signed though, otherwise I can't pass them. There's no evidence. You are really my eyes and ears out there. Clinical instructor informs that the case study needs to be completed, sign this, and then have them sign that they're aware of it. And if they're not passing the data arc evaluation, they need to realize that in the middle of their rotation, not at the end. So please be fair to the students, let them know what their deficiencies are. they don't correct themselves, it's really up to them to fail the data hierarchy evaluation. Not that I've seen many cases, but it will happen. Now, this is a note for our students. They see they have all the items in Canvas. Canvas is what we use for the college to give them documents and such. And I'll train the students as well. At the end, you see the pink again is for students. This is their to-do list. After they're done with the course, I'm asking them to deliver a bunch of items to me, and that's their job, and they sign this off. You don't have to sign this document. It's their responsibility. That's the purple packet. It is quite long. Please take the time to read it and let me know if you have any questions. Thank you.